name is Danny, and I am the patient care coordinator here at TherapyWorks and Vibrant Health Solutions. And I am here today with Rachel Barron. She is one of our awesome PTAs here, and we are talking about neck pain and injury. So I know neck pain is kind of one of the top conditions that we treat here. And why is it so common?
Well, you have 7 joints in your neck, so there's a lot of opportunities for things to go wrong. Your head is very heavy, it weighs about 10 pounds, and if you're walking down the street, I'm sure you can notice a lot of posture nowadays. Head forward, shoulders rounded. It creates a lot of tension in those cervical muscles, and so there's a lot of people who come in due to postural issues as well as other cervical diagnosis.
Okay. Yeah, I know I tend to slouch a little bit just like in daily life. So since working here I've been told to fix my posture, so I attempt. But okay, one type of neck pain we talk about a lot is tech neck. What is tech neck?
Yeah, so kind of like I mentioned a little bit before, that forward head, rounded shoulders with the advancements in technology, that's great. But a lot of the times, we're at our computers or on your tablets or phones, and so you kind of get to be in that curved posture, which then, like I said, increases tension on those muscles and can cause some pain.
Right, yeah, like especially when typing at a keyboard all day or sitting at your desk. I bet that's super common. When someone is experiencing neck pain, what are some stretches that might help?
Some of my favorites are upper trap. So here, I always tell my patients, pull your shoulders back, keep your nose pointed forward, and then just tilt like you're gonna touch your ear to shoulder, and then I'll have them hold for about 20 seconds. We'll do the other side. Another stretch that I really like is levator. So, like again, keeping those shoulders pulled back to promote that good posture alignment, and then turn your head to the side, and then dip down towards your armpit, and you should feel that one more in the back of your neck. So those are two of my favorites, and I try to do them throughout the day too.
Yeah, that second one is my favorite. Just like that pull right there. Because because I sit at my desk for most of the day. So, what exercises or motions help improve neck pain?
So a couple other of my favorites that are really easy to do. I like to tell people to do these throughout the day are shoulder rolls,
Okay.
going backwards, to help promote cervical scapular retraction. Again, hitting that posture, really wanting to make sure that we're not stretching out those muscles and then making them weak and tight. And then another one that I really like is also scapular retraction. So that's just fancy word for squeezing those shoulder blades back. For those people watching right now, if you check your posture, your shoulder blades might not be pulled back. So you can pull those shoulder blades back, and you'll feel it. You'll feel that muscle engagement. And I like those because people say they do them at stoplights, or you can do them at your desk. You can really do them anytime throughout the day. So I like to throw those out there, and just because they're so easy.
Yep, I tend to do those at my desk. Okay. What are some good ways to avoid neck pain or injury?
So thinking posturally, I don't know how many people have heard ergonomic, just having good ergonomic position at your desk. You can kind of look up the guidelines to make sure that you're following that. They don't want your arms to be too high so that your shoulders are scrunched, or too low so that you have to lean forward. Having your chair at a good height. So those are different things that you can kind of address to make sure that you have good posture. Also, sleeping positions. If you're a back sleeper, typically the flatter the pillow, the better, because you don't want your head too far forward when you're resting.
Oh, okay.
And then for side-lying sleepers out there, I always like to say get a pillow that helps the alignment of your spine. Your cervical spine match the rest of your spine so that you're not, unintentionally doing that upper trap stretch in a wrong way. So getting a pillow that kind of helps align the neck with the rest of your spine.
Okay, I'm a side sleeper, that's actually very helpful. I did not know that. Lots of people have neck pain. How do I know if it's bad enough to get physical therapy?
So really, knowing pain versus like soreness, pain is never good. I think a lot of the times we're like, oh, it's not so bad. I can live with it. I can push it off. So realizing that pain is not normal, and I think a lot of times it's normalized, we take ibuprofen and all that good stuff. So getting in while it's not so severe, leading into if you've had this pain for a long time, that's also an indication to come in and do either a free screen or an evaluation for your cervical pain. If your neck pain is persistent, you get sharp stabbing pains, even a dull achiness, those are things that can be indications that you really should probably get it checked out.
Okay, awesome. Why is it better to seek treatment earlier rather than later?
Really, you have better recovery time. The more chronic, longer conditions take a little bit more time to work through.
Okay.
If it's more of an acute pain, injury where it's happened recently, like within the week or so, the earlier we get started on that, the better results that we get. So it's just typically it's a shorter duration of treatment, and you get better results.
Okay, awesome. All right, well, that was really great. Lots of great advice. Anything else before we sign off today?
No.
Awesome. Well, thanks, Rachel, for joining us today. And like she said, if you want to call to get in to schedule a complimentary consultation, we would love to see you. Everyone have a great Wednesday. Okay, thanks. Bye.